We are here to commence the beginning of 6 weeks of hearings for an increase to paying conditions for nurses and midwives across New South Wales. Our union has been campaigning with our members for more than 2 years, and we're now in a situation where we're seeing a final outcome being decided by the Commission.
Members of many of you have already watched. We've just heard an historic outcome at the New South Wales Industrial Relations Commission following our campaign and our massive case. But we know that for registered nurses and midwives, the outcome today is not enough. There's more work to be done. We will come together and we will continue to hold this government to account.
A step forward, but it simply doesn't go far enough. That's the verdict today from nurses and midwives after they secured an historic pay deal. They say the boost, less than half of what they were fighting for, will only be swallowed up by the rising cost of living.
It just doesn't go far enough. As a mother, raising 2 girls here in Sydney, it's tough.
New nurse to patient ratios will be introduced in public hospitals under the next phase of a new plan. Unions say this comes at a critical time as regional hospitals face intense pressure.
After over a decade of fighting for nurse to patient ratios in our medical surgical wards, we're really pleased to see the Minns Labor government delivering on its commitment, not just to our members, but to the people of New South Wales.
A lot of our regional members are very keen for the safe staffing rollout because they live and work in the community that they are in, and their patients deserve the care and respect and dignity.
2 brilliant announcements by the government today. We see not only the announcement of our new chief midwife, but we see the rollout of safe staffing levels in our dedicated postnatal wards.
They have reached their breaking points. Nurses and midwives at Parkes Hospital, exhausted by chronic understaffing and concerns for their own safety, are now taking action.
Missed out on pain medication, he'd missed out on antibiotics that he'd needed because we didn't have the staff to care for him properly.
An administration officer to handle paperwork, freeing them up to actually focus on patients.
Who delivers care to you 24 hours a day, 7 days a week, on Christmas, on our birthday, on our children's birthday, on our children's school days? We do.
Wherever you travel across New South Wales, we're seeing that, especially in terms of maternity services, they're being closed down in rural areas. It's not the same access to services that people in the city would have.
Staff and patients deserve better. That was the message from Calvary Martyr nurses today, who rallied over reports of mould, maggots and rats at the hospital.
A frank message to the Health Minister.
Ryan Park, where are you? Ryan Park, where are you? This hospital just smells like poo!
Fix the leaks, fix the air conditioning and the mould issues, fix and maintain all our water systems and keep our patients and staff safe.
The union says staff are worried patients aren't getting the best care.
I know in theatres surgeries are being cancelled because of issues with leaks and mould.
Today we've launched a report that unfortunately details the experience of racism that nurses and midwives and carers across New South Wales experience in public hospitals, in private hospitals and in aged care settings. Today we've been joined by employers, by stakeholders, advocacy groups and regulators from all across New South Wales and partnered with the Australian Human Rights Commission to consider what can be done to stamp out racism well and truly in the health system.
It's hard. It's really hard. It's a very, very toxic feeling in there. The only way that we can get safe staffing for the Northern Beaches community is for this to be a public hospital.
Well, today marks a significant and long-awaited milestone for residents on Sydney's Northern Beaches, with the trouble-plagued Northern Beaches Hospital now back in public hands. Northern Beaches Hospital today returning to public hands 8 years after it was privatised.
We're here. We're going to knock at these politicians' doors and tell them what's happening in aged care.
Today we've had a chance to meet with a number of ministers and share stories for ourselves and for the members about how we're seeing aged care minutes being applied in the homes.
It's been really nice for them to take us seriously with the issues that we're experiencing in aged care.
We're continuing to advocate for our colleagues and of course our resident care. We want the best care for our residents, and we want to make sure that the aged care minutes are implemented as what they're intended to be.
For me, as a registered nurse, I fight for that, making sure that the residents are well taken care of. And of course, how can I take care of my residents if me as well as the staff is not being looked after too?
Well, we're hoping that we can get all the things that Annie was talking about, that we can get ratios and that we can see some honesty and transparency in the sector. So we continue the fight, not just for staff, but we continue the fight for our residents.
I think today it was really good just getting to know a lot of other people that are starting out as new grads.
I think they did really well into explaining what it's like to transition into the
new grad nursing.
Yeah.
Sometimes I still feel like a new grad, and I think it's really important to remind them that that feeling never really goes away, and that's a good thing because it means that you're always eager to learn. You know that you're never going to stop learning, especially in this career.
When I say union, you say power. Union power. Union power. Union power. Union power.
This is my third Mardi Gras with the union, and it's just a community coming together and just marching, celebrating love. It's what we do best, is love and care for everyone. So,
Happy International Day of the Midwife.
There's more work to do to improve workloads and more work to improve pay. But look at the recognition midwives are getting finally across New South Wales.
As midwives, we have the opportunity to empower women, to help them to achieve quite often what they never feel that they are actually capable of doing or what their bodies are capable of doing. And that is a great reward for them and also for us as midwives.
I really value the relationships that I form, both with the women and the families that I care for, but also my fellow midwives and the other health professionals I work with.
Happy International Nurses Day. Thank you so much for everything you do, for taking care of us and making sure that we're okay.
We need you, we love you, we support you, you don't get paid enough.
So on this day and for the other 364 days of the year, I just wanted to say thank you.